Talk to our listeners more about how their microbiome is actually going to help them to build more collagen. Like, how does this happen?
Right. So the oxytocin has been shown to trigger the deposition of collagen quite very impressively, by the way. So taking collagen hydrolysates, whether it's bovine, porcine, chicken, or marine, does indeed increase dermal collagen. And by the way, does also increase articular collagen, articular cartilage, and glycosylated glycan lubricant in joints. But the oxytocin effect is much larger. What I tell people, though, is because I think we're following, and we have been following, a low collagen, low hyaluronic acid lifestyle, because most people don't boil a carcass to make soup, stews, and broths. They don't eat the skin on their fish or poultry. They don't eat brain, which is a very rich source of hyaluronic acid. They don't eat intestines like sausage casings, which is rich in collagen. I think we've been all leading a low collagen, low hyaluronic acid lifestyle. And as a result, we've paid the price in the way of accelerated skin, joint aging, and arterial aging, by the way, and perhaps brain aging. There's emerging data that collagen hydrolysates may slow cognitive impairment. I'm not an expert in collagen, Lindsay, but I did a lot of thinking about this because there's recent evidence that while we know that bovine and porcine collagen and chicken sternal cartilage does increase dermal collagen, there's a push towards marine sources like skate, shark, cartilaginous fish, as well as bony fish also like tilapia and others. Well, because I was skeptical at first also, it's a protein and humans digest proteins down to single amino acids. But the recent science from Japan, where they radio labeled collagen hydrolysates, there's a tripeptide called glyprohip, glycine proline hydroxyproline, that is resistant to digestion. And the two dipeptides that sometimes result, glypro and prohip, they make it to the skin intact. And they appear to act as very potent stimulants of collagen deposition in the dermis. So I tell people now, if they really want a skin effect, combine reuteri and oxytocin with collagen hydrolysates, maybe marine sources because they're enriched in the glyprohip tripeptide, and even better, get some hyaluronic acid in your life. Now, you should do that by eating brains and organs, but most people are so squeamish they don't. So, supplementation of hyaluronic acid. I know a lot of ladies use topical hyaluronic acid, and a lot of ladies get injectable hyaluronic acid as filler, as well as into joints. But you can also take it orally and replenish the moisture in the dermal layer of the skin.
That is so cool.